Hey there, I'm glad you're here. Today we'll be discussing about multiple sclerosis. What is it? How is it caused? What are the symptoms? How is it diagnosed? And even the treatment options. So let's get started. So what exactly is multiple sclerosis? It's a chronic neurological condition which affects more than 1 million people worldwide, and it affects the central nervous system, which includes the brain and the spinal cord. In order for the brain to send signals to rest of the body, it goes through nerves, and those nerves are wrapped up in a material called myelin. The body's immune system attacks the own myelin sheath, and over time these damages cause scarring, and that's why the name sclerosis. And since this happens in multiple places, it's called multiple sclerosis. And when this myelin gets damaged, the signals are disrupted or even blocked. Compare myelin to insulation of an electric wire, and if it's destroyed or damaged, the signals can get disrupted or even blocked. This damage can lead to various symptoms that are seen in multiple sclerosis. So how is it caused? So we exactly don't know, and the scientists are still trying to figure it out, but it's mostly a combination of genetics and environmental factors. And even in genetics, it's not clearly like an inheritable disorder where a gene passes from the parent to offspring, but there is an increased risk if your loved one, like a sibling or a parent, has multiple sclerosis. But the good news is that it's not as straightforward as a genetic disorder either. It's a little complicated. And coming to the environmental factors, vitamin D deficiency can increase risk of developing multiple sclerosis, and people who live in colder regions with less exposure to sunlight are at an increased risk as well. And it's speculated that viral infections like EBV or infectious mononucleosis thought to be triggering the symptoms or the episodes of multiple sclerosis. But like I said, we don't have all the answers yet. Now, what are the symptoms of multiple sclerosis? This is a little bit tricky because it depends on which part of the central nervous system is being involved. The most commonest ones are fatigue. This is just not like a regular tiredness. It's more than that. It's kind of a deep exhaustion that doesn't go with rest. Vision problems. People have blurred vision, pain with eye movement, or even lose a portion of vision in one of the eyes, and this is very characteristic of MS. They also might have double vision. Weakness. If the motor tracts in the brain are involved, that manifests as weakness, then they can also have numbness and tingling sensation, like pins and needle like sensation in the areas which are affected. And gait imbalance, falls are experienced. Even bowel or bladder continence problems are also seen. Now you must be wondering, since you know the symptoms, how is this condition diagnosed? We do a detailed neurological examination trying to find what's the weakness, what is the sensory problem, how is their vision, how is their cognitive status, and that sort of thing. And after that, we'll be doing a MRI with and without contrast to see if there are any lesions in the brain. So if there's any inflammation, the contrast can leak into these areas, and it can show up on the MRI very easily. We'll also sometimes need to do like lumbar puncture, where we get a sample of the cerebrospinal fluid, the fluid which is present around the brain and the spinal cord, to see if there's any protein production or abnormal proteins. Those tests will also be useful to rule out other conditions that could be mimicking multiple sclerosis. Other ancillary tests could include visual evoked potentials or Bayer's, which are studies to see how the signal is transmitted via vision to the brain, and if there's a delay, then it would suggest that it's multiple sclerosis. So now, what can we do about it when there is a diagnosis of multiple sclerosis? The goal of the planning is to actually reduce the progression of the disease, because this comes as multiple episodes, and treat the relapses, which mean that there is a damage and there are acute symptoms which needs to be treated, and also alleviate the symptoms like with supportive management. The first and cornerstone of the treatment is disease modifying therapies. These can be oral medications, injections, or IV infusions. And these are mainly to reduce the activity of the immune system so that it doesn't attack the whole body and cause damage to the myelin. These really change the course of progression of the disease. And then we also use steroids to reduce the severity of the relapses, whereby there's a sudden inhibition of immune system temporarily, and that causes rapid improvement if the patient is experiencing acute symptoms. And also supportive treatment with physical therapy, speech therapy, occupational therapy. Other symptoms like spasticity and pain can also be treated with medication that relieve those symptoms. The other treatments is basically like lifestyle changes, exercise, stress management can also be helpful in these patients. A healthy diet and supplementing with vitamin D will also be helpful. Now, I know this may sound overwhelming, and knowing about this condition can help manage it properly. If you or someone you love is suffering from this condition, remember that you're not alone. There are several patients, caregivers, and professional providers who are working together to improve the lives of people who are suffering from multiple sclerosis. MS doesn't define you. It's part of your life, but it doesn't control you. With the right treatment plan and support system, people with MS can lead full and active lives. If you have any further questions or doubts regarding multiple sclerosis, since we just did a superficial overview of the condition, please comment below and share your experiences, and I'll be happy to answer them or try to address them in a different video. Please share it if you found this useful. Until next time, take care and stay healthy. This is Dr. Rayi signing off.